Good day everyone. Our topic for today is intestinal worm. Intestinal worms are one of the two main types of intestinal parasites. They live in and take nourishment in intestinal tract. Intestinal parasites include both helminths and protozoa. Today, we will focus only on helminths such as tapeworms, hookworm, roundworm, and flukes. Intestinal worm infections are distributed throughout the world. About 2 billion people were infected with worm worldwide, and about 1.5 billion people in developing regions of Sub-Sahara, Africa, Asia, and Americas were infected. In Malaysia, worm infection is high among people who are poor, from rural areas, has low knowledge about worm infection, and with poor socio-economic, environmental, and behavioral factors.
Fluke is a type of flatworm, and the disease is known as schistosomiasis, and it can be divided into two species. You probably won't notice that you have been infected, but small, itchy red bumps on skin can appear in a few days. After a few weeks, some people develop more apparent symptoms. Pinworm is a type of roundworm, and the disease is known as anthrabiasis. The species involved is Anthrabius vermicularis, which occurs worldwide, with infections occurring most frequently in school or preschool children and in crowded conditions. There are few signs and symptoms that can be experienced by a person, and it mainly involves the genital area. Ascaris is a type of roundworm infection, also known as ascariasis, and the species involved is called Ascaris lumbricoides. Ascariasis is the most common roundworm infection. The infection usually causes no symptoms, but a high number of roundworms can lead to problems in the lungs or intestine. Moderate to heavy infestation causes various signs or symptoms depending on which part of the body is affected. Trichinella is a type of roundworm species called Trichinella spiralis. The disease involved is known as trichinosis or trichinolysis. Trichinosis is most widespread in rural areas throughout the world. When a person is infected, that person may or may not have any symptoms. However, within 1 week of the initial infection, the larvae will enter muscle tissue. Once this happens, the symptoms usually become more apparent.
Okay, tapeworms and hookworms. Tapeworms, a type of flatworm. The body is made of segments, and each segment is the size of a grain of rice, and they can live in a person up to 30 years. So, they are flat, long, usually 3 or 10 meters, and adult tapeworm can grow to be 30 feet. Hookworms, a type of roundworm that lives inside the small intestine where they attach themselves to the intestinal wall with a hook. They usually have an inch long. So how do you know if you have these worms? Once you're exposed, you're going to have abdominal pain, bloating, loss of appetite, unexplained weight loss, rash, itching around genital area or rectum. Plus, some of the cases, people pass worms in their stools during bowel movement.
So have you ever wondered how worms can be transmitted?
Commonly, it can be transmitted through skin penetration, especially when the soil is contaminated water that entered through body by ingestion, and through raw or uncooked meat, which usually due to the consumption of infected animal. Eggs or larvae will enter the body through the gastrointestinal tract. Then, it will go to the small intestine to become a mature adult worm. It took around few days to weeks for it to become mature depending on the types of worm. This mature worm will go to the large intestine. Adult worms in the large intestine are able to travel to the end of the rectum. At this site, they lay their eggs which can be excreted out through feces and infect other people. Other than ingestion, they can also enter through skin penetration, where the larvae will penetrate the skin and go to the small and large intestine. So who are the people at risk? People in developed countries or in rural areas are at risk to get intestinal worm due to the unhygienic area around them. Next, people who engage with handling of livestock and farming are often exposed to soil, which increase the risk to get intestinal worm. For children, they often at risk if they play around the contaminated soil. Moreover, they cannot properly take care of their own hygiene yet.
Okay, boys and girls, time for medications. Okay, so we have mebendazole, albendazole, praziquantel, parenteral formulate. So how do these medicines work? Well, by starving the worms and by paralyzing the worms. So take these medicines with or without food? It depends. Praziquantel, you have to take it with food, whereas mebendazole, you can take it with or without food. So how do you take these medicines? Well, they exist in tablets and suspensions. For tablets, you can swallow whether it's whole, halves, in quarters, and they're sometimes chewable. Suspensions, shake before use. But fear not. The most important thing is take the medication exactly as directed by your doctor or pharmacist and take it at regular intervals. Do not skip and continue to take the medicine even when you feel better in order to clear the infections. That being said, these medicines can affect you during your daily activities. If you're affected, do not participate in activities that require you to be alert. Other side effects include stomach pain, nausea, vomiting, diarrhea, and headache. The most important thing to note is that inform your doctor if any of these side effects do not go away or are severe, or if you experience other side effects.
What we need to do to prevent worm infection. For worms that are transmitted through ingestion, we need to practice a good personal hygiene such as washing hands, especially after using toilet, before handling foods, and after touching animals. Besides, we also need to keep fingernails clean. Secondly, we need to do a proper cleaning of fruit and vegetable in hot water. Eat only cooked meat. Please avoid eating raw meat. And lastly, please avoid getting contaminated food or water. For the transmission through skin penetration, please wear shoes outside. Avoid skin contact with soil that may be contaminated. And lastly, please avoid skin contact with animal poop. Hope you enjoyed watching this video. Thank you.